Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Hello and welcome to Fronteras, a Changing America. I'm Anthony Moreno. On the program, we talk about health. In a few minutes, we will learn about new research that shows how depression may impact those with diabetes. But first, we bring you a profile of a local life flight team helping high-risk medical patients in our region. Our senior television producer, Andrea Vasquez, has more on work being done by Air Methods.
This is not the normal type of aircraft that you'd find out here.
We'll come into work at about 7 o'clock in the morning. We'll get a pass-down briefing with the off-going crew and see how their shift went, see what kind of missions they were on. We'll check a bunch of equipment. We'll issue ourselves drugs for the day and narcotics for the patients. Head out to the aircraft, make sure all of the aircraft systems are functional, all the medical systems are functional.
Right now there's 4 nurses and four medics and 4 pilots, and then we work on a 3-man crew, so there's always 3 people on base at the time. We're working on hire 4 extra nurses just because we're such a busy base, a high volume base, that they want to rotate us more often in between flights.
We'll receive a flight request from our comm center. The pilot will do a weather check and make sure that we can safely complete the transport and complete that flight.
Pilots will show up, shift change is 7 o'clock. We'll do kind of a pass down with the off-going pilot. Check the aircraft out, make sure everything's the way it's supposed to be. We'll review the logbook, make sure there's no open discrepancies, anything like that.
And we'll assemble the aircraft in about 10 minutes and try and be off the ground in about that same amount of time. And we'll head towards that patient.
It's basically an emergency room. Just condensed to fit in the aircraft. So we can handle back-to-back probably 2 or 3 flights if we're just going down into El Paso with the amount of medical equipment and stuff that they carry. So it's basically an emergency room. This is a Eurocopter EC-135. So it's a twin engine, light utility helicopter. We have a custom interior, of course, to do the medical stuff. I think each engine's about 750 horsepower, something like that. So a lot of power, pretty quick, pretty smooth.
We're specialized in critical care. So the majority of the patients we transport are very sick patients, whether it be traumatic injuries from like a motor vehicle accident or some kind of a rural assault or other trauma, and take care of a patient who maybe that hospital may be ill-equipped to take care of. So a high-risk medical patient or a high-risk obstetrics patient. They usually utilize our services for the sickest of the sick. People that can't survive the ambulance transport.
Our bread and butter run is going to be picking up here locally in Las Cruces, taking a patient down to El Paso. Sometimes we'll end up going up to Albuquerque, but the scene calls are different because you never really know what you're going to get into as far as where you're going to be landing, what the patient condition and stuff is going to be like. So it's everybody's kind of on their toes. You don't really know what you're going to get into until you're there.
So depending on diagnosis is depending on how we treat the patient. If it's a trauma, they're actively bleeding out, we're giving blood, we're stabilizing an airway. If it's neurology, they have a brain bleed, we're checking, make sure there's no deficits or they're not getting any worse, and just giving medication to try to bring down the pressure in the brain. So it all depends on what kind of patient we're transferring.
Normally when we come on shift, we're looking at about 3 flights a day. It's a normal pace for this space.
Our standard turnaround time is going to be around 2 hours. For instance, we'll fly from here over to a local hospital. It'll take the med crew about 30 minutes or so to what we call package the patient, get them hooked up to their medical equipment and all that stuff.
I think it's important because we're fast, and then we get to start the process in the route over there. It's not like, oh, we just scoop them, go. We actually have the tools. We have blood in the helicopter if they're bleeding out. We have medications that we could give to bring down pressures in the brain and stuff like that. So we start the care here, and then we get them the fastest possible to where they're going to get definitive care.
All of the clinical staff at Air Methods have at least 3 to 5 years of pre-hospital experience as a paramedic, or 3 to 5 years of ER and ICU experience as a nurse. and that gets you through the door to come on with the company. Then we receive hours upon hours of indoctrination training and ongoing education.
I believe it's about 2,000 hours that you have to have of flight time and experience built up before you can come into the air medical industry like this. Especially down here in southern New Mexico, this time of the year, our monsoon season can get kind of sketchy. When you're trying to make a weather call, it can be very difficult. Not quite sure where thunderstorms are going to end up, if there's going to be hail in it, or how severe they're going to be, if it's going to build up and blow up into something where you get stuck somewhere, can't actually transport the patient.
I think mindset's really important. I think the mindset that most of us develop is that we need to not focus on the injury, but focus on our ability to take care of it. I think we try and go through a meticulous process and a very regimented process of finding life-threatening injuries and fixing them in line with how we find them, and stabilizing the patient as best we can.
I think it's significant and important because we get people where they need to be in a timely manner.
It's actually very rewarding. I don't know if it's selfish or not, but it's a very rewarding job when you realize you've actually impacted somebody's life and made a difference for them, hopefully in a positive way.
According to new research from New Mexico State University, depression may cause premature death among adults in the U.S. diagnosed with diabetes. Here to share more about this is Jagdish Khubchandani, Professor of Public Health at New Mexico State University. Jagdish, thank you so much for taking the time to talk with us.
Thank you for having me here.
What was it about this research that really drew you to this topic?
Much of my research focuses on mental health issues and how it affects the general population. But there's not much known about what happens when a person has chronic disease and also depression. Does it change their life course in a way that they start losing life years? And so I'm, in a way, expanding on knowing not just mental health, but how it affects people with other types of diseases.
So tell us a little bit more about this study and what you took a look at and what sort of data you looked at.
So first, October was Depression Awareness Month, and November is Diabetes Awareness Month. We combined the two problems from the National Health and Nutrition Examination Survey. So people who participated in this national study from the early 2000s, we linked them to their death files. What happened to these people who were living with either diabetes, depression, none, or both, who survived the most and who survived the least. And then we started looking at the final outcome of their life. Whether you have depression or diabetes or both, which group is supposed to survive the most?
Now, there's obviously a lot of concern about diabetes and the folks who are impacted by it in our region. Just how big of a problem is this for our area?
In New Mexico, we are much, much higher than the national average. So as of today in the United States, at least 30 million people live with diabetes. Some 90 million have prediabetes. And then among these, we have millions of people who have diabetes, but they don't have the official diagnosis because they're not getting checked. In New Mexico, because we have poor access to healthcare, poverty, the kind of food people can afford, the rate of diabetes is much, much higher than the national average. So as of today, 10% Americans live with diabetes, at least. And in New Mexico, that number is much higher. We still need more precise estimates, given that at times we miss the people who can be diabetic and we have not diagnosed them, or they have not seen a doctor to be diagnosed with diabetes.
I certainly want to dive into a lot of those issues a little bit more with you, but I like to hear just about what type of diabetes you took a look at with this study.
We took a look at type 2 diabetes, and we looked at adults above the age of 20. And so these are people who have officially been diagnosed by a healthcare provider with diabetes. And then we divide them into different groups: with diabetes, without diabetes, with depression, no depression, diabetes and depression both. And among all the groups, we wanted to see who's surviving the most.
Now, this study is about how some of the folks with depression who are diabetic, have been diagnosed being diabetic, may experience premature death. What sort of impact are we talking about when we're talking about premature death?
So, any American who has diabetes today will die at least 3 years to 5 years sooner than the average person who does not have diabetes. Same with depression. If a person is diagnosed with depression, they may die 3 to 5 years sooner than the other person who does not have depression. But when you combine the two, depression and diabetes, you're losing at least 9 to 10 years of life. The risk of death increases 4 times having both the disorders compared to having none. So individually, those disorders are lethal, depression and diabetes, but when they combine, they become super lethal.
Those are certainly alarming statistics. We're living in an area where there is a challenge of diabetes and also access to not only healthcare, but mental health care as well. So what's the growing concern with folks in our region who may be experiencing these things?
In our region, I think that the national average of how many people had a blood sugar check last year, we rank very low. And how many people have been diagnosed with depression or have depression, we rank in the top states. Furthermore, most people with diabetes in the United States, the majority, will get some kind of treatment, but most people with depression will not get any treatment. And that's where I think New Mexico has a complicated landscape, a shortage of mental health professionals, income inequalities among people, our lifestyles, and the general lack of education and awareness about blood sugar, blood pressure, symptoms of depression. And so New Mexicans are losing more life years compared to the average American nationally if they have depression and diabetes. And one way to attack that would be to raise massive awareness campaigns on diabetes and make it a decentralized approach that let's make blood sugar check an easy thing for an adult New Mexican at convenience stores, laundromats, wherever we could.
When we're talking about people who may be experiencing depression and diabetes at the same time, what sort of demographics seem to be the most prominent in your research?
Yeah, it's mostly people who are lower income, lower education, live in rural America, rural New Mexico, do not have many financial resources, not have much social, emotional, financial support. And sadly, those problems occur in these people, both depression, diabetes, and other chronic diseases. And so we are looking at a super high-risk group of people. Little education, income, awareness, resources, suffer from diabetes, cannot manage it, and end up having depression and dying sooner.
What about gender? Did that stand out?
Yeah, gender, we have different types of studies, but generally, it does seem like males would die sooner because they also then start self-medicating, for example, with depression, using alcohol, drugs, other types of risk behavior engagement. With women, it generally seems like once they know they have diabetes, they may want to change their lifestyle sooner than men. So yeah, men would die sooner if they have both the diseases.
Was there any ethnicities that stood out more than others?
Yeah, predominantly African American people, Hispanic people, racial ethnic minorities. But again, beyond race and ethnicity, it was the income factor. Living near a hospital or having access to health care, having health insurance.
How can having depression impact somebody's life? You brought this up a little bit just in the lifespan of years, but I mean, what other areas can it really impact?
There's new research about this, ongoing research always. First, we used to believe it's only psychosocial, that if someone is diagnosed with depression, most likely they'll not be able to take care of themselves. They won't have the cognition to realize what a healthy lifestyle is. Frequently, they won't have employment. They will have neglect. People would not want to be around them. And that is the psychosocial part of having depression and being at risk for diseases and health problems. Now, the new research suggests that if you have depression, your body immune system changes, your vascular system changes. Inflammation occurs throughout your body. Your vascular repair is damaged, that is disrupted. So we are looking at psychosocial problems and then biologically how depression puts you in a state of inflammation where your body is secreting a lot of cytokines, hormones, which may cause heart attacks, strokes. And so it's a cascade of problems, both psychosocial and biological, that is actually causing sooner death. So people with depression and diabetes are more likely to have heart attacks than people who have none of these two diseases. And it's both biological and psychosocial.
One of your focuses has been largely on mental health. What do we know about just how much genetics play a role in mental health? For example, if somebody has a parent that has depression, what do we know about the chances of them experiencing that as well?
Yeah, genetics plays a big part, but the recent global consensus is that lifestyle behavior and social circumstances dominate the genetic makeup. And even in the case where people have a poor genetic makeup, putting them in adverse situations may actually start manifesting the problems. So yes, genetics plays a role, like many people in the United States who live with schizophrenia, or now there's research showing suicidal ideation has a genetic component. But I still believe that because we cannot control the genetics, we should focus on the psychosocial aspects of mental health issues. That's something where we can make a difference. We cannot change people how they're blessed with their genetics, but yes, psychosocial aspects we can change.
You've talked about this a little bit, but how can having depression or even diabetes impact somebody financially?
Yeah, I mean, these are expensive diseases. I mean, the average cost of treatment for diabetes, the extra burden financially is $9,000 per person in the United States per year. If you have diabetes, that expense, either the government has to pay or the insurance company. Frequently, there's a lot of out-of-pocket costs. So yes, people with diabetes have a lot of financial challenges. And sadly, because they have so much stress of diabetes, and if they get into depression, how many of them are able to hold stable employment or make enough wealth? And so yeah, those two diseases cause a lot of financial issues. And frequently there are uncovered costs of changing your lifestyle, getting that medication, the copay. And diabetes sadly has become the leading cause of death worldwide, among the top 10. And globally, as we see obesity increasing, diabetes keeps increasing, but our wages don't increase that much.
Through the research that you've done, not only with this study, but over the years, how big of an impact does obesity have on these factors dealing with diabetes and maybe even depression?
Yeah, I mean, it's clear relationship between being overweight and being diagnosed with diabetes or depression. And I think that if we have to bring back a national strategy or a global strategy for health and consider the biggest threat would be obesity, nearly linked to diabetes, depression, cancers, other hormonal disorders. And as we continue to see a third of Americans now live with obesity, we cannot expect depression and diabetes to go down unless we have that obesity piece covered and addressed.
As somebody who studies public health, how do you think the United States is doing as far as education goes with these factors, with diabetes, with depression? Are there some things that health officials perhaps are not talking about that they should talk about more?
Yeah, I mean, we are in a difficult spot in the United States with healthcare system. We spend $4 trillion every year, which is the highest on the planet, more than the GDP of many nations, but our health outcomes are very poor. We don't rank in the top 5 for best diabetes care, mental health care. And I think the problem is because we look at healthcare as cost, access, quality, the triangle of healthcare. What's missing in that triangle is prevention interventions. Unless we are focused on prevention, we'll lose it. Our narrow focus is how to improve cost, access, quality, but we don't talk of how prevention can be infused in this triangle. And that's where we suffer.
As we're seeing more of an issue with diabetes, we're seeing more commercials perhaps on drugs that help prevent diabetes or help those with diabetes that people may be prescribed from their doctors. What does this tell us about how we're taking on this problem?
The sad part is last week we had a global issue discussed, fake Ozempic, fake weight loss pens making into United Kingdom, US markets. What is happening is that a third of Americans live with obesity. Globally, more people now live with obesity. Many of them actually want to lose weight, and they fall in this trap of prescription, a weight loss supplement. Let's go to the neighborhood grocery store. And that diet supplement market alone is billions of dollars that is causing more trouble. Instead of telling people, change your diet, start moving, we are giving them these shortcuts, medication, diet supplements. Nearly half of the people in the United States last year took some type of diet supplement to improve their health, but what did they gain? Nothing.
You're talking about $1 billion industry.
Yeah.
There's a lot of money going on in the supplements, but what are your concerns about the supplement industry growing as large as it is today?
It's been unhinged, out of control. I think in the Clinton administration, they had a provision with FDA that supplements should be evaluated, monitored, and then they removed it. Now the FDA does not care if you have a supplement in the market. They can just say approved, but they will not evaluate the efficiency, efficacy. Unless someone complains about a supplement to FDA, we will have all these supplements come out, people will continue to use them. The problem is, what's the gain? Money is being lost, and also now new studies suggest that these supplements are actually dangerous. People are having heart attacks. And above all, it takes away the focus from obesity, diabetes, the real problems that should be dealt with by lifestyle changes and qualified healthcare providers. So this whole concept of self-care, self-help with supplements is not good. Self-help by internet, trying to look up symptoms is good, but using a supplement, it's a no-no for me.
For those folks who may have diabetes and may be dealing with depression, is there any research out there that you came across that shows that, hey, there may be an answer to folks who are dealing with both of these problems on how they can perhaps add years on their life?
Yeah, the addition of years of life clearly will not happen with supplements. What will happen, what needs to happen if people need to add years of life, stick to your diabetes management aggressively. Don't take risk with it. Manage your food, exercise, get into self-help groups, find similar people, and then do stress reduction, exercise. The best medicine people can do for both of those diseases is exercise. And that would add years of life and prevent early death. What is happening is out of control depression and out of control diabetes. What is happening in the few years, people are starting to have heart attacks prematurely. And those can be prevented with exercise, sticking to your medication, finding resources to help yourself in the community, and not going into all these alternative supplement industry or whatnot. These do not help if you do not help yourself with exercise and diet.
So, Jagdish, how important is it to find a medical provider who is trained to treat people with mental health disorders for folks who may be dealing with depression and diabetes?
Yeah, it's complicated. We need one of the avenues where the modern healthcare systems lack is the collaborative interdisciplinary care. Diabetes is a complicated disorder. Depression is complicated. There's no specialist who can deal with both. Maybe a primary care practitioner could, but having specialists on a team and providing coordinated care to a person is key, because you have to monitor blood sugar, other biomarkers, same with depression, symptom monitoring. So yeah, it is critical to find qualified people, but on an average, most people in the United States, majority, 50% or more, will not be able to find dual care. Either they'll find diabetes care or depression care, but not both.
What is it you think that policymakers can take away from this research that they should be aware of?
They have to make it a point that they know diabetes, the root cause comes from many different factors, of which obesity is a major one. And we need to have a national strategy on obesity. And then for diabetes and depression, how to make it easier for people to get at least screening. Do I have diabetes? Do I have depression? At least as a first step, make that easy. Because sadly, today we don't know exactly how many people have diabetes or depression or both. And from our study, from latest statistics, we had a tough time finding exactly how many people are suffering from both.
And you brought this up a little bit, but access to medical care to get those things evaluated, how challenging is that for our region?
Very challenging. If you move to Mexico or go to Far East Europe, someone could just walk into a pharmacy or a local provider, and within 5 minutes they will know what their blood sugar looks like. And here in New Mexico, it is a challenge. You need to find a provider, then get into the testing part. It's not free. I do believe there are some initiatives like New Mexico State University has our local health center giving a blood sugar check this month for $20. But many people don't know about it or cannot afford the $20 or may not care about knowing it. But if I walk into a grocery store and you make it free for me, I'm okay getting a prick in my finger and knowing my blood sugar right there. So unless we take it to the consumer, it's difficult.
Speaking to folks who may be concerned about this, I mean, what do you tell people who are, concerned on if they wonder if they're diabetic or not, and why they should care to get tested?
Yeah, the earlier you know that you have diabetes, the longer you can live. The later you know, the sooner you have a tendency to die. So anyone who suspects that their mom, dad had diabetes, their food is out of control, or they are getting diabetes type symptoms, because 90 million Americans have pre-diabetes. They're not at that threshold, but they have high blood sugar. And so I guess every adult should now, at least once in a year in the United States, get a blood sugar check. It should be like a national initiative, get your blood sugar checked.
And what does research show us on how having diabetes may lead to other problems?
I mean, once people have diabetes, their focus goes on managing it, dealing with the symptoms, so financial challenges. Then being stressed about it, emotional challenges. And those stress cycles and deprivation cycles may eventually cause failure of kidney. If you're not able to manage it, it affects the kidney, affects the eye. Diabetes comes with a lot of complications. It's one of those disorders where you're just troubled with every body system if you don't manage it.
And my last question, just what do you think this study can do for the awareness of mental health?
Yeah, we have to see that many people in the United States have a chronic disease of some kind. At least a third of the people watching our show may have a chronic disease. And again, out of those third, a lot of people will eventually start having depression or anxiety because they deal with a chronic disease. And they need to, at least at home, start managing their stress about their chronic disease so that they don't go into depression. Because once you have two types of diseases, physical and mental, then it gets even more challenging.
Jagdish Khubchandani is a professor of public health at New Mexico State University. Thanks a lot for joining us.
Thank you.
As we close our program, we want to take a moment to recognize our senior television producer, Evelyn Sandoval, who is moving on from KRWG Public Media for another opportunity. Over the last year, Evelyn has directed and produced this program and shared powerful stories that have truly made an impact. Evelyn also worked at KRWG as a student. It was a great joy to have her join our professional team and watch as she mentored current students on our crew. Evelyn, we will miss you very much, and we wish you all of the best on your next adventure. That's it for our program. You can keep updated anytime at our website, krwg.org. I'm Anthony Moreno. We'll see you next time.